The side effect profile is extremely minimal. But before we speak about the side effects, and all medicines have them, remember the amphetamine base that has been used frequently in the past, they were real side effects from those. Many of the doctors call those legalized speed. Many patients have gone to clinics and gotten those. They have tremendous side effects, tremendous danger to the heart and their heart rate, rapid heart rate, jitteriness, all those things that make them very uncomfortable. And at the end of the day, those patients are still hungry. The side effects are not the same for this medicine because it is secreted naturally by your intestines. It's a simple protein called a peptide. And so all the side effects have to do with gastric. They're all GI. The first 2 weeks, patients are told to anticipate maybe just a couple of episodes of some loose stool. Very mild, but that's fairly consistent. Some patients, very rarely, less than 5%, will have a little bit of nausea. But that can be mitigated by combining and adding a medication that helps with the nausea. And so the patient is supplied with that very, very low risk. It's very interesting that later, after being on the medication for about 4 to 5 months, it may transition to a bit of occasional constipation. Some may have some mild indigestion. But when you look at the benefit, out of 900 patients under the medication, less than 5 stopped because they had nausea. That was just a bit too much for them, or diarrhea that they could not control. It's very, very rarely. The way that those side effects are combated is by starting very slowly. They titrate the person or go slowly at a quarter of a dose for the first 2 weeks, then half a dose for 2 weeks, and then they move them up to the full dose. By doing that, the side effects are basically a non-issue. If we have someone that has a little more diarrhea or a little bit of nausea, they will just slow down the schedule and they will keep them at a quarter dose, for example, 3 or 4 weeks, or a half a dose, 3 or 4 weeks.